Hello and welcome to the East Lake Pet Talk podcast. I'm veterinarian Dr. Karen Fling.
And I'm Dr. Will McCauley. We'd like to welcome you to a different setting today. You may notice that our scenery is a little different. We're actually at the clinic. We're at East Lake Veterinary Hospital, and we're here with some friends of ours who have come to talk about a very important topic that you may have seen in the news, canine influenza.
That's right, and all of us devote our lives to animal health and caring for pets, and there's so much going on with influenza right now, and there's avian flu, there is swine flu, there's flu in people, flu in dogs and cats. And in fact, just this week I visited the emergency room with one of my children, and talking to the emergency room physician, I understand that there's just a huge uptick in flu cases in people. And also we've got the big news out of Chicago right now where there is a huge outbreak of canine flu. And so what do you think about all of this?
You know, it's really interesting because we've talked about canine flu for years now, but it's been one thing that it's difficult to test for,
right,
and to prove that it does exist. And now with the outbreak in Chicago, finally there is proof that flu does occur in dogs.
Right, exactly. And the tricky thing about testing for canine influenza is that so often I think people, when they have a sick pet that's showing the signs of influenza, maybe a fever, lethargy, coughing, respiratory type symptoms, sometimes people try to wait it out. Sometimes people try medicine to see if it gets better, and then when the pet isn't better, they try the testing. And by that point, we typically don't get a positive test. Don't you agree?
Yes, that's correct, because their biggest period of shedding is before they actually start showing their peak clinical signs. And so by the time you see them, their shedding may have dropped off and you're no longer able to pick it up on a PCR test. Then you may have to rely on serology testing down the road after the animal has either recovered or died.
Yeah, so blood testing, and even that, as I understand it, you may have to do a test at the point that the pet is not getting better and then repeat another test 2 weeks later.
2 weeks later.
Very, very time consuming, very involved. And so I think the best advice is that if you have a respiratory condition going on with the dog, that you get that testing done early, find out if in fact it is flu or not. And one thing that I love, we actually use Zoetis brand vaccines, and with those vaccines there's a fantastic guarantee to where if we have a currently immunized pet that starts showing respiratory symptoms, then we have the guarantee that allows us to do that testing right at the get-go before we even start treatment. And so that's terrific peace of mind. Don't you agree?
Yeah, that's a great quality to have in a vaccine if they back it up like they do. About Chicago, is the same strain that's going on in Chicago the same strain we've been seeing for years now, or is it a different strain?
It's actually different, and the thing that we have to understand with influenza virus is that it mutates very frequently, and that's why the human vaccines, every year they try to guess which might be the most prominent strains that are going to be in the flu vaccine.
This year they didn't
for
do too
people.
good a job.
This year they didn't do as good a job, that's correct. And so what they found is this outbreak in Chicago was actually a different strain of influenza than what is in the current canine vaccines.
So that one is an H3N2.
Right.
Okay, and then the vaccine in dogs that we currently use is H3N8, correct?
That's correct.
Brings up a good point that there are different kinds of flu out there. Just like we said, there's different strains. For humans, there's different animals that can have it, so not just us and dogs. You may have heard of avian influenza, swine influenza, and those are all different strains of the influenza virus, correct?
Right, and horses have influenza. In fact, they think that's how the dogs actually got it. It mutated enough in the horse that it jumped species and caused disease in dogs from the original horse influenza.
Right. Well, and I think, the important thing to consider here is, especially if you do have a dog that has a social lifestyle, that immunization really is key to helping those pets be protected. And whether we're talking about influenza or kennel cough, as it's called, I think vaccine is one of the best things that we can do to keep these pets safe. And even the term kennel cough, I've always had an issue with that, because it is truly, I would say, the #1 most common infectious disease we see in practice. Don't you agree?
Oh, by far, I would believe.
And those are dogs that don't necessarily go to kennels, and so I think people think it's something that only comes from a kennel. So anything where a dog has a social lifestyle, from going to dog parks, going places with their family, with their owners, to going on walks, and even one of my own dogs, I know I've mentioned this before, wound up getting kennel cough where he hadn't been anywhere. He was just in his own backyard, and presumably a stray going along the McCauley sniffed noses, maybe coughed, and
Right.
boom, he had it, and then one after another. Each of my dogs got it after that. So anyway, it's out there and it's common.
As the vaccine for the standard strain of canine influenza, has it been shown to be very efficacious when given properly?
Absolutely, it has. There is study data to show that it is very efficacious when used correctly. It is a vaccine that requires a booster post the initial injection and then followed up annually,
Right.
once a year.
Right. Well, if in doubt, and if anybody has questions about the influenza vaccine, definitely consult your pet's doctor, or if you have questions, you can call us right here at Eastlake, and you can reach us at 214-342-3100. And finally, as far as respiratory disease issues go, are there any parting words that either of you would suggest for the pet owner to be aware of and to be cognizant of?
Sure, so I would add to that, you were talking about your social lifestyle of your pet, if you go to dog parks, if you go to doggy daycare, which a lot of our dogs do go. It's important that you vaccinate your dogs for the viruses that we have available, as well as for the bacteria that we have available as well. Because a lot of these respiratory diseases, they feed off of each other, they co-infect. So you may as well be, as protective as you can of your dog and use the vaccines that we have.
That's a good point. That canine influenza virus, when paired with a Bordetella vaccine, which is the actual bacteria that causes classic kennel cough signs, has been shown to really kind of give a 1-2 punch to rule out all, or to control all of the causative organisms of kennel cough.
Yeah, and I think it's important to understand that it's really not kennel cough. It should be called canine infectious respiratory disease, because there are
Right.
probably a dozen different viral and bacterial agents that can contribute to respiratory disease in a dog. We don't have a vaccine for all of those, but as veterinary professionals, what we should be doing is protecting the animals with vaccines against the antigens or the viruses and bacteria that we have vaccines for. We should be in the business of prevention and not trying to treat after the fact.
We
Right.
always say an ounce of prevention is worth a pound of treatment, that's for sure.
Right,
Yeah.
and even though there's some variable strains to some of these organisms, the feeling that is out there is that even though no vaccine may have all of these strains covered, that by doing the vaccines you may reduce the severity possibly of some of the other strains. So I think that's good medicine. And in terms of the symptoms that we see with any of these respiratory complexes, anything with a cough, anything respiratory, you want to be on top of that right away. Do your culturing at the first sign of any symptoms rather than waiting, and then definitely seek treatment, because many of these respiratory diseases, even influenza, if treatment is started early, then there is an option to help these pets get through the disease, as opposed to waiting and letting the organisms, the disease progress, where we may see pneumonias or fatal consequences, as we've seen in Chicago. And one particular case a while back ago that I witnessed and saw from afar, it wasn't a patient here but elsewhere, the family that had this dog went through $10,000 of expense treating a respiratory condition that progressed. Pneumonia happened, and fortunately the dog made it, but with intense treatment at an internal medicine center. So
Whereas
nobody
a
wants
$22
that.
vaccine could have helped prevent that
Right.
progressing like that. So we always highly recommend that you get your pets vaccinated for all these diseases we've talked about over the course of many shows. We do have the canine influenza virus vaccine available, so definitely give us a call. If you have a question, shoot us an email at podcast@welovepets.net. I want to thank our friends for coming in, our colleagues, professional circles for coming in and talking about the canine influenza virus. We look forward to seeing y'all again on a later show.
All right.
Thank you for inviting us.
Thank
You
you.
bet. And we'll be back next week, same time, same place, for more of the Eastlake Pet Talk podcast. Thanks so much.